All right, I'm here to address the Minnesota Care purchase plan proposed by the governor, to talk a little bit about that and address any questions that you have about that, and also about the Republican proposals that are moving forward. The governor has proposed opening up Minnesota Care for everybody else, or what was proposed by President Obama as a public option. It was not popular then. It's not going anywhere now in this session, and with just a few days to go here in the session, we believe that we should be focused on the solutions that actually will bring better care to more Minnesotans, to bring down the cost of care, to make insurance more affordable, and to bring care to where people need it across the state of Minnesota. Most people understand that the problem isn't that government isn't big enough in the area of health care. The problem is that government is too big and has screwed things up in Minnesota. Minnesota led the country, led the nation, led the world in health care, providing very high quality care at very low cost. And that Minnesota model can lead again, and we believe that we have the solutions to do that. And this public option is just another step backwards into 2009. We don't believe that that's really something that should be put forward at the end of the session at this point. We see that the governor has included sick tax, bringing that back, the 2% sick tax as part of this program. Also making this government program available to rich people across the state. Putting those folks onto a government program is a bad idea, and this is really what is really most dangerous about this idea, is that it reimburses hospitals at 50% of what private insurance does, so that absolutely will close the doors of particularly small rural hospitals. That's why we think it's a bad idea. It's not sustainable. We would think that we should have more affordable choices for people in the insurance market, so that they can buy stuff again that they can afford, rather than put more people on a government program that underfunds hospitals and clinics. So we believe that those strategies are ones that we should focus on with such a very, very short time left in the session, and that we should not continue to drag out this 2009 product that didn't work then, and it's not going to work at the very tail end of session. So we were going to focus on solutions that work for Minnesota families, Minnesota doctors, and Minnesota hospitals. And with that, I'd be happy to answer any questions.
The governor's been pushing for this the entire session, including in his State of the State address. And he says now you have bills that would specifically prohibit this from happening.
Well, I think what will prohibit this from happening is the fact that this will close the doors of hospitals if we were to move forward with this. We cannot afford it. And also, we need to strengthen the individual insurance market in Minnesota. The bottom rusted out of the bucket of individual insurance. A few years ago, we've temporarily kind of restored that, and this would just send it in the other direction. And also, if you're a small employer, why would you keep your small business policy if you could simply discharge all of your employees onto a government program, which is what we'd see. Then if you're in the small group market, you're going to see that happen. What happened to the individual market happened to small group in the upcoming years. So we just think it's a step in the wrong direction. Minnesota Care is 93% subsidized by taxpayers right now. It's 7% pay-as-you-go, and they can't collect the 7% that they have billed out. The department came to us and said, there's over $30 million that we know people owe us, and we can't figure out how to collect the $30 million. Why on earth would we expand this program to more people, to put rich people on a program, when we can't take care of the people who really need help currently and can't collect money for the bills?
Follow-up on that, to Tom's question, is there specific language that would prohibit this from happening?
Well, there's no way to fund this program within this. The governor, within our budget, certainly, and it would be extremely bad policy for moving forward with the state.
As the governor said, you are specifically prohibiting this.
Well, there is no way to fund it mechanically, and procedurally we can't move forward with it. It's a non-starter.
The administration says that people's premiums would cover their cost. What would, you don't believe that, I take it, and what would be the cost?
Well, it sounds great, and if it sounds too good to be true, it probably is. Currently, within the Minnesota Care program, we can't collect the 7% that people owe us. We don't know how to bill or collect for that as a state. So why would we expand this and hope that that would somehow work? But really who can't afford this is the hospitals in greater Minnesota that currently are hanging on by their fingernails. And if we cut their reimbursement by 50% by moving people from private health insurance to government pay, they're going to close their doors.
Governor Dayton said the reimbursement rate is going to be negotiable, and they can come up with something that will keep the hospitals from closing.
Well, he raises taxes in his bill and reinstates the sick tax, expands this out as an idea, takes $130 million and redirects it to try to prop this up by turning the Department of Health and Department of Human Services into an HMO. But there is no money in here to restore payments to hospitals and doctors. That does not exist, even within all of the money within his bill.
What do you think rich people buy on the individual market?
Well, rich people would be able to buy a government program through Minnesota Care. People who currently don't qualify would essentially, it would be open to anyone. And the question is, Minnesota Care was designed as a program for low-income people. If we put rich people onto this program and subsidize it, theoretically, and cut reimbursement rates, that doesn't really seem like a good long-term strategy for Minnesota. We should really be focusing on the things that we can do by continuing to strengthen the individual insurance market and trying to provide some different options to small businesses, farmers, and families.
Who's rich? I guess I'm not following that. Rich people.
Well, currently, Minnesota Care is not available to, you have to qualify for it by income, and that kind of depends on how big your family is and so forth. But this would be available to anyone. Making Minnesota Care available to anyone
So do you think millionaires would apply for this?
Well, I think it would be available to anybody in the state, and if we have currently a program that's designed for people of low income and we make it available to rich people and subsidize it and cut rates, that's a bad idea.
And you say rich people, but we had a farm couple in here who makes roughly $100,000+. Is that a rich person, rich couple to you? A rich family?
Well, people who currently don't qualify for it, instead of saying let's find a government program that they qualify for, make a government program fit whoever it is, whether it's a farmer or whether it's a business owner or whoever it is, maybe we should be able to find insurance products that used to be able to be affordable to people like that, that can't find them anymore. Why is that? We need to find more ways to bring insurance products back to families who should be able to afford them in the first place. Certainly hardworking farm families with high premiums, deductibles, and co-pays need some relief. We've stabilized the market a little bit, but we need to provide more options to bring those costs down rather than create a new government program to try to put people on.
We have providers who tell us that the reimbursement rates would be reduced, it wouldn't afford them a yacht, or they would keep the doors open. Do you disagree with that?
Well, if your reimbursement rates are here and that you cut them in half, that's going in the wrong direction for hospitals and doctors. So if you're going from if you're currently relying on private health insurance to subsidize your hospital or your clinic, putting more people on a government pay program is not going to help you. It's going to hurt you. All right, thanks.